Good morning, guys. My name is Heath Turner. I'm one of the PGY1 medicine interns on the project looking at resident burnout and mindful meditation and its uses in this particular setting. So today we're just going to kind of walk through the abstract, discuss a little bit about what all this project entailed and what we found. So as far as background goes, burnout's been in the news and kind of the top of the list of discussions in mental health and stuff around residents, physicians, medical personnel in general, especially during this recent pandemic. And so we were hoping to find something to kind of target the burnout or help us decrease the burnout, I suppose. And so mindful meditation is something that some of our group members had used in the past personally, and through research and literature review, it looks like has been beneficial in, decreasing, anxiety, depression, not necessarily burnout. And so we were hoping to look at it specifically among resident physicians and decreasing burnout. So the aim is we sought to assess burnout among UMKC, specifically internal medicine residents, and whether mindful meditation resources are effective in curbing the extent of burnout. And so the methods we used a professional fulfillment index survey. It's a standardized 20-point questionnaire to assess burnout. And so we used that pre and post intervention. So we did it first as a baseline and then assessed it again after 6 weeks of intervention. For intervention, we asked the residents to use the Headspace app. For those of you not familiar, this is a app that's able to be downloaded on iOS, Android devices alike, possibly computers, I'm unsure, that kind of walks you through mindful meditation. And so you don't have to be an expert in this. You don't have to have done it before. You really don't have to have any knowledge of how mindful meditation works at all. You can just follow this app and kind of walks you through it. And so fortunately, it was free during the pandemic for anyone with an NPI number. And so it gave us a really good window to try and use this as an intervention for burnout. Then we used the pre and post survey of the professional fulfillment index survey and compared them using a Fisher's exact test. So the results, we found that there was no statistically significant reduction in burnout based on the responses to the questions in the survey and the pre and post surveys. Significant, of course, being the cutoff of P of 0.05. Subjectively, only 35% of participants in our project found mindfulness meditation helpful, but 55% of the participants reported using mindfulness meditation only once or fewer times per month. So, we were kind of at the whim of resident participation, and although it wasn't utilized as much as we had hoped, this is the results that we came up with. So the conclusion, despite our PowerPoint presentation on the proven benefits and free access to the Headspace application, as well as, some reminder emails that everyone appreciated getting, I'm sure, only 45% of the internal medicine residents engaged in participation in mindfulness meditation. Of those that did participate, there may have been a reduction in burnout. 35% of all participants found the Headspace meditation application helpful, but our study was limited due to only 20 residents completing the entirety of our survey questions. So this increases the likelihood of the type 2 error, and without a larger study with more power, kind of unable to assess a true reduction if there is any. So this is kind of our project, and like we wrapped up, I think it could warrant a larger study and would be needed in order to use it as a proven source of reduction of burnout. Thank you.